Okay, so this video is going to be about some other ways to help prevent cancer. So there's like some combinations of foods, but the first one is papayas with pineapple. Now, what this does is that it helps increase metal transcription factor, but you also have to have a healthy gut bacteria for it to work, because the gut bacteria, because some gut bacteria like saccharolytic bacteria are involved in quorum sensing and biofilm formation, because biofilms might also bind cadmium. So by trying to degrade biofilms in order to, because of cancer and bacteria they use biofilms to protect themselves, but by doing that, by degrading the biofilm, you might also lose the cadmium binding effect. And what can actually reduce the biofilm is chocolate, because chocolate has components that can shift the microbiome composition, and basically the effect that this reduces TMA, which also reduces TMAO formation, which is also good for heart health, because TMAO comes from choline. Choline is in eggs, but in order to reduce the TMAO, you can use chocolate. But chocolate also degrades the biofilms, so you're getting a double whammy effect with the chocolate, that you are reducing the TMAO, and you are also reducing the saccharolytic bacteria that are involved in quorum sensing that would build the biofilm. So chocolate also degrades the biofilm, which kind of makes it easier for immune cells to attack any cancer cells that might have been using the biofilms. But back to a papaya and pineapple, is that well, if you don't want to use chocolate, because then that would degrade the biofilm, because biofilms kind of bind cadmium. You can use papayas with pineapple, because papayas contain cysteine-rich thiols, and pineapples contain bromelain. So the bromelain cleaves CD44, CD62L, and this actually facilitates gene transcription activation. And the outcome is that this boosts metal transcription factor 1, which binds heavy metals like cadmium. Also, papayas also downregulate biofilms, which would reduce the cadmium binding benefit. Okay, so another thing that's beneficial from boosting metal transcription factor 1 by pineapple is that you also get less iron trapped in macrophages, because when that happens, there's less iron available for mitochondria, which leads to less ATP, and then the immune cells are weaker. Also, there's no iron for vitamin A to work, because vitamin A is needed to boost intrinsic factor from the parietal cells, which and vitamin B12 needs the intrinsic factor to work, which leads to reduced homocysteine. Because if that's not reduced, then you have a higher inflammation, higher risk of cancer, also cardiovascular risk, possibly other problems. So basically, boosting MTF1, which is short for metal transcription factor 1, is that this binds iron, and it reduces the sequestration of iron inside the macrophages, instead of it being locked away. Also, by making the iron more available, it helps maintain the macrophage function. And what that does is that it actually responds better to lipopolysaccharides, which is a gram-negative bacteria that's boosted, or that results from gluten exposure or taking in gluten. Like pizza has gluten, some breads have gluten. I think crackers have gluten as well. Also, rice has gluten, but I think the gluten is a different type of gluten. So this basically the iron being available helps the macrophage respond better to lipopolysaccharides via the toll-like receptor 4, because the macrophage has the toll-like receptor 4 on it, and then the lipopolysaccharide like binds or interacts with that toll-like receptor 4. So basically, as a result of iron being available, it also improves the antigen presentation to cells or to T cells. Okay, another piece is that pears, which are one of my favorite, is actually can actually help with the CRT exposure, or CRT is short for calreticulin, on cancer cells. So basically, that's the danger signal that appears on the surface of a stressed or dying cancer cell. So it marks them for recognition and phagocytosis by macrophages. So pears are rich in polyphenols, like flavonoids and phenolic acids, vitamin C, and dietary fiber. So basically, the polyphenols can induce a mild oxidative stress in cancer cells, which may promote the translocation of CRT to the cell surface. So basically, that means that the CRT, the cancer cell is trying to hide the CRT away from the macrophage, because the cancer cell doesn't want to be seen by the macrophage. So the polyphenols in pears forces the CRT out on the outside. And then also the vitamin C in pears also protects the normal cells, but selectively stresses the cancer cells. So the pears are choosy. The vitamin C can actually, and the antioxidants can differentiate between a cancer cell and a normal immune cell. So instead of attacking the immune cell, the pears stresses the cancer cell. And this actually leads to the pears increasing the CRT exposure on cancer cells, and it makes them more vulnerable to immune attack. And the way that immune attack works is that CD1, or a CD91 receptor on the macrophage recognizes the CRT that the pears made the cancer cell express. So the CD91 binds to the CRT, and then that triggers a phagocytosis, which is the immune cell engulfing the cancer cell. Also, pears also help the immune cells become even stronger against cancer cells by boosting PGC1A. Basically, what PGC1A is it boosts mitochondria, and it makes them stronger and more resilient, and I think it also increases in numbers. So basically, that means that there's a lot more ATP for immune cells to have energy, because immune cells are they're a high energy demanding cell, and if they don't have enough energy, then they can't fight, and they can't fight cancer cells. So that's why. So basically, the pears is having a double whammy effect. It weakens the cancer cell by bringing out the CRT, and then it boosts PGC1A, so that it boosts the mitochondria. More mitochondria equals more immune cells or macrophages to attack the CRT on the cancer cell surface. So the scenario would play out that that there's going to be a huge number of macrophages if there's more mitochondria, which would favor in a fight against cancer, and if there's a lot of cancer cells. Please like, subscribe. I'll see you in the next video.